It wasn't until Tannard and Verpeel, two fairly bright guys in Ghent, Belgium, developed a new technique that really facelift made sense to me. The reason facelift didn't always make sense to me is people don't come into our office and say, I want my skin pulled like this, because they feel that it makes their face look distorted. They've seen too many movie stars on television who really don't like, well, people don't like the way they look. They look pulled, they look tight, they look windswept. And Tannard and Verpeel said, stop doing that. Really, stop pulling the skin backwards. Take the skin in the vertical direction. Do what people do when they go and sit in front of the mirror. When they go in front of the mirror, they don't take their neck and go back. They take their skin and they go up like this. What that does is it takes this cheek fat that used to be up here on their cheek and is now sitting down here on their nasolabial fold, making this fold look deeper. And they'll take this cheek fat that's now hanging down as a jowl. Their face used to have a vertical V shape. Now it boxes out and looks square. And so what Tannard and Verpeel said is really what you want to do is leave all of that skin attached to the gristle tissue in the lower face, not elevate all of this off, and then try and do a procedure at the level of the gristle tissue. And so this is the only example that I can think of where less truly is more. Let me explain their style of facelift, which is also known as max lift, M-A-C-S. Max stands for minimal access cranial suspension lift. Well, minimal access means it's a really short scar. So instead of a scar that starts on the side of the head, comes down along the ear, behind the tragus, this is the tragus, and extends back behind the ear, their incision starts here and ends right here. It starts in front of the sideburn, comes across with a zigzag in front of the sideburn, and ends just at the lobule, just below the ear. And so it's a very short scar. Their dissection, where they elevate the skin off of the gristle tissue, is just this distribution. They leave the neck alone. If there's excess fat in the neck, they'll liposuction it, and that's included in this procedure. Neck liposuction is a portion of max lift for those who need it. But then they leave the skin attached to the gristle tissue, and there are ligaments and dermal ligaments, and really all of the innervation is much deeper to that gristle tissue, and since you don't elevate it, the risk of nerve injury is significantly less in max lift than it is in regular facelift. Well, what they do when they have the skin elevated is they come just below the arch, this bony arch of the zygomatic bone, that's your cheekbone arch, and there's a broad, flat muscle and a really broad, flat tendon that goes underneath that arch. So they've elevated the skin, they get down and they take a good heavy stitch and they put it right in that tendon. And that tendon isn't going anywhere, and it'll hold the stitch really good. And they'll then take a drop stitch. Now this is a single stitch. It's kind of like heavy test fishing line. And they put it in and out of this gristle tissue, in and out, and then right back up. And then when they tighten that stitch down, watch the neck, it pulls the whole neck up. Then they put in a second stitch. And the second stitch is more of a roundish stitch in front, and that pulls the jowl and the nasolabial fold fat and brings this fat right back up. Now they're pulling here, but it's pulling all the way across the midline of the neck. And so by doing that on both sides, it gives people all of this lift, and it's a vertical lift. It's not a horizontal lift. And by giving that vertical lift, all that's left really to do is without tension, without tightness, just peel off this extra skin that's bunched up right here and sew it. This operation takes about 2.5 hours to do.